How to give first aid for hypothermia. Have you ever thought about what to do if someone is suffering from hypothermia? It can be a life-threatening situation, but knowing how to respond can make all the difference. Let's break down the steps for giving first aid for hypothermia so you can be prepared. First, if you suspect hypothermia, call emergency services right away. Time is of the essence, and professional help is essential. Next, move the person to a warm, dry, and sheltered place. This helps stop heat loss from contact with cold surfaces, wind, and wet clothing. Once you are in a safe location, remove any wet clothing from the person and dry them thoroughly. This reduces heat loss from evaporation. Be gentle when handling them to avoid causing heart rhythm problems. Help them lie down comfortably and try to keep them still to avoid unnecessary movement. Now, focus on warming the person's core first. Cover their trunk, neck, and head with dry blankets or an emergency blanket. It is important to avoid warming their hands and feet at this stage. Warming these areas first can cause cold blood to flow back to the heart, which can worsen their condition. You can also use external heat sources to help. Hot water bottles or chemical heat packs wrapped in cloth can be applied to the neck, armpits, and groin. These areas have large blood vessels close to the skin, which helps warm the body. Just be sure to avoid direct contact with the skin to prevent burns. If the person is awake and able to swallow, offer them warm, non-alcoholic, and non-caffeinated fluids. This can help raise their body temperature from the inside. However, if the person is unresponsive or not breathing, begin cardiopulmonary resuscitation immediately while continuing to warm them. Stay with the person until help arrives. Keep an eye on their breathing and responsiveness. It is important to avoid rapid warming methods, such as immersing them in hot water or vigorous rubbing, as these can lead to dangerous complications like heart arrhythmias. In a medical setting, further treatments may include warmed intravenous fluids or airway rewarming with humidified oxygen. These treatments depend on the severity of the hypothermia. By following these steps, you can stabilize someone suffering from hypothermia and increase their chances of survival until professional help arrives. Remember, being prepared and knowing what to do can save a life.